Okay, great. All right. Yeah, so today I wanted to talk about what all I have learned from my dry eye journey. And like everyone's journey through any autoimmune or any chronic disease, it's a journey in itself. It's so I have had dry eye for around 10 years now. I was a full-time software engineer. So my work involved a lot of screen usage, and around 8 years of my full-time career, I have struggled with dry eyes.
And Nishant, may I
So
just
yeah,
request you to be a little louder?
done. Yeah, sure. Yep. So around more than 8 years of my career, software engineering career, I have struggled with dry eyes. Struggled to find out why it's happening to me. Struggled to find out how it can be fixed. So I have been to almost every proper eye clinic in India which can understand dry, which has some treatments for dry. And I have done almost that most of the treatments that are available in India for this thing. So I have a very good understanding of what is available in India, why it happens, and things around that. So to start with, like there's some when I was thinking about this thing, I realized two doctor statements that happened. The very first consultation that I had was when I had started my career. It was around 2 years into my career. So the doctor said that there's no problem about it. You'll totally be fine. You'll be able to hire people to put drops in your eyes. You just put eye drops and you'll be fine. And the last consultation I had around 2 years back and that was with a very big surgeon in India who understood dry, who is one of the top ophthalmic people in dry eye today in India. He said that even after using scleral lenses, you were better for 2 months and now you cannot bear them. I really don't know what can be done. So it's like not that of a depressing note, but the reason I wanted to tell about these two statements is it started from a doctor who did not understand the criticality of it, who did not realize how bad it could get. And then finally, then that after when I had tried everything, I met a humble doctor who said that you have tried everything. So it's not that sad as such per se. I really hope to get back. I understand ways to manage myself much better. So I hope to get back to my normal career. Let's see. Yeah. So, as I said, I wanted to thank Kirtida madam for allowing me to present this opportunity. Also, she helped me attend the Sjogren's Foundation event for dry eye. So recently, there was a Sjogren's Foundation event, an international event by Sjogren's Foundation on the complexity and details and management things around dry eye. So some of the learnings from this session are thanks to that. Finally, I am not a medical professional. Everything that I am telling here today is based on my own research and learnings and talking to community. So while I would like to help you people as much as I can, I really cannot help with respect to which dry drop you should take, which medicine you should take, and all. So I would request to not share such questions. Apart from that, everything else is all good. Sounds good? Anything else before we start with the content? Audio, video, all good?
All good.
Okay, cool. So before we start, there are two important links that I want everyone to copy. I'll share it in the chat box. So the first one is the slide link so that you can see the slides later. And the second one is a blog that I have hosted for comments. So if after this session, if you have any questions around this topic, you can put any comment there, and when I have time, I'll be able to reply to that. Again,
Nishant, will
non-medical
it be
comments.
possible to put these links on our WhatsApp group? Because
Yeah,
after
I'll send that.
closing the, yeah,
I'll do that. Yeah, I'll do that. Okay.
You can do that later also. So now you continue with
Cool.
your session.
So going back to the slides. Yep, yep. Yeah, slides are available here. All the slides. And this is a blog where after the session you can put in any comments. Right. So any comments you put, I'll like when I find time, I'll be able to reply around this content. Right? Okay. Cool. So to begin with, I just wanted to start with a little bit introduction of dry. And I personally think that this is very important because it is very complicated disease. And while we advise everybody to stay with for any chronic disease, you should stay with your doctor and trust the treatment and give in full dedication to that. But due to various reasons, sometimes you might switch cities, you might switch places, you might end up switching doctors, and because it's a chronic thing, it can go bigger. So you need to understand what it is about. And more importantly, it's a very complicated thing. So that's this definition is from the Tear Film Society. So there's a TFOS International Society around tears. Dry is all about tears. So to focus on it, it's basically a multifactorial disease. So multifactorial as in there are numerous factors involved. So you cannot just say that you understand dry eye because dry is as simple as less lack of tears. It's not at all that. It is at least as complicated as autoimmune diseases go. So what I want to emphasize by this is that please don't copy treatments blindly. If sclerals are working for somebody, there's no guarantee it will work for you. If serum drops are working for somebody, it will not work for you. There's no guarantee. So always start with your doctor's guidance, and copying is actually not going to get you to a lot of places, right? Second thing I wanted to emphasize is it is something to be taken with seriousness. It can potentially damage your ocular surface if it goes out of control. So if dry eyes go out of control, your corneal surface gets eroded. You will see, you must have seen extreme dry eye cases. People cannot go out of their house. Their eyes are very red and all. So that is when dry eye starts damaging your ocular surface. So you should take it seriously like your autoimmune diseases and take care of your eyes. Right? Okay. So as I said, understanding dry eyes helps everyone a lot, right? So this is just a very basic slide to explain how tears work. So tears, we usually think that tears are just water. They are water. Water is a big part of it. But then there are three layers, majorly three layers. At the top, we have oil layer, which prevents the water from evaporating. Like every day when our eyes are open, the water evaporates. So if you have a good quantity of oil, the water will not evaporate, right? Oil stops evaporation. And then you need to have water, of course. If there's no water, there's no eyes are not getting hydrated. At the end, there is a mucus layer as well. I'm not very much aware of these details, the detail of this layer, but these two are very important ones. So we have two kinds of glands in our eyes responsible for the nervous system. Lacrimal gland is on the top of eyelids. This is the gland which secretes the water part of it. And then we have meibomian glands which are in our eyelids. They secrete the oil layer. Right. So in autoimmune diseases generally, so lacrimal gland is what gets affected to begin with, and hence the watery component is what gets affected. Now eventually it becomes meibomian glands also, because of like there are theories that if one part is less, the eye system over regulates oil, so this also starts getting affected. But for autoimmune, lacrimal is what generally is affected. So aqueous layer is what is very less. Water component is very less. Right. Okay. Yeah, so that's a basic understanding that everyone should have who has dry eyes. Now, to begin with, there are different kinds of dry eye. So you should have a fair idea. You should have some idea if it is possible for you what kind of dry eye you have. So there is something called an aqueous dry eye. Aqueous means water. So the water layer is improper. So you either have less water, it is not proper constitution. Then there is evaporative, where your tears evaporate very quickly. Like you have tears, but they just blow away. That happens because of improper oil layer. And then mixed is when you have both of the things. Some level of aqueous, some level of evaporative. Finally, there is corneal neuralgia, which is a very like unusual case which people are not aware of, but this is the most severe one, and it's not related to autoimmune per se. We'll get to it in a little while, right? And like if you have any queries, you can feel free to ask me. We also will also have a question time for questions in the end, right? Okay. So aqueous, less water; evaporative, less oil; mixed, and neuralgia, right? So as I said, it is a very complicated thing. So this slide is just to say how complicated it is and how difficult it is that copying somebody's treatment will help you, right? So aqueous, as I said, autoimmune usually is around aqueous. So Sjogren's primary or secondary Sjogren's, it leads to aqueous deficient eyes, means water is less. So you have problems of grittiness, uncomfortable, and itchy eyes. Dry, that is usually happens with dry eyes. For Sjogren's kind of patients, aqueous is what gets affected first. And then there is non-Sjogren's, that also causes aqueous. There can be a lot of reasons to that. Your lacrimal glands are obstructed for whatever reason. Whatever drugs you are using, like anti-allergic drugs and acne drugs, can are known to cause this thing. So this is also a short diagram. It's not fully blown, but this is just to say how complicated it is. Then there is evaporative. Evaporative is you have oil deficiency for nutritional reasons, whatever. And since meibomian glands are in eyelids, your eyelids don't close properly. Some people have some physical reasons due to which their eyelids don't close. So that causes evaporative dry eyes. And then you don't blink enough. Then Accutane is a acne drug, which is very well known to cause evaporative dry eyes. Then there are nutritional deficiencies, vitamins A. And then if you wear a lot of contact lens, you have some allergy. So it's very complicated. Yeah. Is there a question? And
And Nishant, I just have one question.
Mhm.
How a doctor diagnoses what is the cause of dry eyes, like whether it is because of aqueous or because of evaporative. So, is
Yeah,
there
we'll
a
in
diagnosis for that?
you'll in the upcoming slides you'll be able to get the
Okay.
answer to that question. If not at the question and at the end, we can discuss further. Right? Okay. Yeah. So as I said, aqueous evaporative is the standard classification, and then there is corneal neuralgia. So corneal neuralgia is a relatively new definition, hence it's not there in that one, but it's also a very serious case of dry eyes. So these are the patients who don't have any signs. You'll see their eyes are perfectly fine, and usual tests that we'll just talk about, they'll also be fine for them. But these people are actually suicidal, and they are so suicidal that they cannot go out of their house, unfortunately. So this usually happens to patients with, and like I don't want, that's just a blunt term. I know a friend who has had this thing and he has recovered today. So it usually happens to patients with LASIK and such surgeries when they don't go well. Sometimes to very few people, LASIK and such eye surgeries don't go well. And then their nervous system in the eyes gets affected. So your eyes actually are supposed to have nerves like this. But when the LASIK and such surgeries don't go well, your nerves drop down to very few number. And then those patients unfortunately get very suicidal because anything that happens around their eyes, they go out, there's a little bit air, there's a little bit pollen, there's a little bit dust. It irritates their eye system very, very badly. So if anybody has had LASIK and such surgeries and they have unexplainable dry eye, then neuralgia is a very likely thing. They have microscopes, confocal microscopes to check the nerves, and they'll be able to see that the nerves have dropped a lot. It would be something like this. The proven treatment for that is autologous serum tears. So, using your own blood, eye drops can be made. That is called autologous serum tears. These tears have a lot of healing. They have lubrication, of course, and they have healing factors. So they eventually regrow your nerves. The timeline is that is obviously very individual, but that's the proven treatment for that. Okay. Now there was a question, and the next answer is for that. What are the tests for dry? So for anybody who has dry, it is very important to understand these basic tests and track them. Track your values from like time to time whenever you go to meet a doctor, because that is what will tell you where you stand, right? So the first one is called Shermer's score. Anybody who has gone to any proper dry eye clinic, you would have seen all of these three tests which I described now. So there's a strip which is put into your eyes, So if your eyes have tears, the tears will start flowing in, and the doctor can see in 5 minutes how many millimeters is covered. So for an ideal person who does not have dry eye, it would be greater than 10 millimeters. For anybody who has dry eye, it can even go to zero, depending on how severe your dry eye is. So this is majorly about your aqueous component, because that is what flows. Okay. So second one is tear breakup time. So tear breakup time is how quickly your tears are breaking up. This is about evaporative. So what doctors do is they put a dye, which is green or blue color, in your eyes, and they look at it and in the slit lamp. So when they first put the dye, it is completely green color like this. As the tears start evaporating, as in when the due to external factors, the tears start evaporating. That is when black spots start coming. That is where the tears are breaking up. So breakup time is the interval between last blink. So when you blink again, the dye flows again. So this black spots will go away. But when it is completely green and the first black spot comes, that is when the tears started breaking up. That is the breakup time. So ideal for a normal healthy eye, it is more than 10 seconds, the breakup time. But for unhealthy eye, it goes again depending on the severity. So when doctors see the black spots and the green spots, the time between green to black spot, that is the breakup time. The more quickly your tears evaporate, that means your oil layer is not okay. So if this evaporates a lot, then that means you have evaporative component of dry. Okay. So the first one is aqueous test. This is breakup time. There are a lot of devices to do it. The results will be in terms of graph and all, but ultimately it's a time value of how quickly your tears broke up. The final one is meibography. So when your meibomian glands, the glands which secrete oil, they get impacted very much. Again, these are varied. Your glands start dropping out, as in glands have physical deformities. Ideal eyes should have very well formed meibomian glands like this. You can see that in a lip view kind of device. When your glands start getting affected, the you can see the glands are dropping out. Here the glands shape has changed, dropped out a lot. Here you can see the glands are almost gone. This is a very severe case of dry eye when no oil will be secreted. And if no oil is secreted, how many ever drops you put, drops will have their own oil. But whatever your natural tears are there, they'll just go away very quickly. So you can imagine you blink, tears come, and then they go away. So people keep blinking again and again. They keep putting eye drops, but still does not help. So this is a very severe case. So generally all these three tests are done for any person who has severe dry eyes. Check the water level, check the oil level, and check the glands. Right. So if you go to any proper dry eye clinic, they should evaluate on you on these three metrics, and then you should also have a mental understanding on how good or how bad you are. Right. These are the standard tests. Okay. All right.
One more
So
question, Nishant.
yes.
When you say dry eye clinic, are these special clinics for dry eyes? Because I have seen a lot of hospitals in Delhi, but they are like normal eye hospitals. But I was not able to figure out any such clinic called dry eye clinic. So when you say any dry eye
Yeah.
clinic, so are there any
Got it.
special dry eye clinics?
Yeah. So they are your standard eye hospitals, but they need to have a division for dry eyes. Like as I said, when I first went to the first doctor I went to, she just checked, I think, my eyes under a slit lamp. Of course, it was, I think, 7 8 years or 10 years back. She just checked my eyes under a slit lamp. A slit lamp is what can give you this.
Okay.
And if they use this dye staining, if they don't use this dye staining, then they'll not do this, and more importantly, they'll not do this. Most importantly, they'll not do this requires a particular device. So it's an any normal eye hospital, but they need to have people who understand dry. So fortunately in India we have very good clinics available all around the country. But let's say you go to a clinic which does not understand dry for whatever reason, they'll not do any of these three tests on you. If they don't do any of these three tests on you, then um just to say that you're not in the right place.
Correct.
Right.
Yeah, understood. Thank you.
Okay.
I would also like to add here that if you all recall, we did two sessions, one in July and another one in I don't remember whether it was October or something. Both focused on dry eyes. The LV Prasad Eye Institute uh, session that we did there, they have a very structured department which deals with dry eye problems. Similarly, in Shankar Netralaya, also they have a division which focuses on dry eye management. And the program that we did with Code Eye Care, they are also an upcoming, they're the offshoot of the Shankar Netralaya, but they are focusing a lot on tear film and ocular surfaces and working on treating dry eyes. So those who have very severe problems and can afford to travel should ideally go to these specialized centers whenever possible, because they definitely understand dry eye and dry eye treatment better than just an ordinary ophthalmologist who has hardly seen five or six Sjogren's patients. So that is one recommendation, that if you do go to a specialist, or within the city also, you may have some people who specialize. They'll have their regular practice, but they will also be aware and would have dry eye clinics, or they are aware of what to do with dry eyes. So try and find a doctor who you feel confident that they understand dry eyes and they're able to give you the correct prescription for your problem.
Yep.
So I'd also like you to go back and visit the recordings of those two sessions, because you will get a lot more content on how much doctors do understand dry eyes, especially those who work on that area. So thank you, Nishant. You can please go
Yeah.
ahead.
Yeah. So just to add to what Dr. Kirtida madam said, so I have been to all of these three clinics, and they are, I can very confidently say, they are amongst the best in India. So if you like, if it's possible, you should really visit them if you have a severe case of dry eyes. Right. Okay. So that being said, and theory is done. So the next few slides are my learnings on how I have managed my dry eyes. Right. So the first one, most obvious one, is lubricative drops. So we have, your doctor would have suggested to you to use drops. Various compositions are there. These are the most common and economic and easiest way to avoid your dry eyes, right? So for the lack of a better example, I have put point A is that people can smoke in public. People do whatever in public, and sometimes initially I was also very hesitant to put in drops into my eyes, even when my eyes were killing me. Like I would just wanted to sleep. I was like, why should I put drops? But people smoke and all in public. We should try to get comfortable to use them in public if we need. Right. So you should not overdo the eye drops, lubricative drops. You should not put more than what you need, but you should also not put less than what you need. If your eyes need them, you really should use the lubricative drops that are suggested by your doctor. Don't just go random eye drop shopping. There are risks around that. Right. And if you use eye drops on a hourly or more frequent basis, you should use preservative free ones. You can talk to your doctor if your need is like on an hourly or more basis, right? And if your doctor suggests gel based or ointments, you can try that. Different drops work for different people, because somebody's oil layer is different, somebody's aqueous layer is different, right? Okay. And finally, I am not against Ayurveda or functional medicine, but please be very careful with Ayurvedic drops in your eyes. So I know an ophthalmic surgeon who again had very severe cases of dry eyes. She has dealt with many people with corneal issues, very severe corneal issues. They put some non-standard drops in their eyes, and now their eyes are non-repairable. So while you can take medicines and all is fine, but putting anything topical in your eyes, it's very risky. So please avoid non-standard drops if you can. Right? Try to use the ones which are recommended by your proper ophthalmic doctors, which has been studied a lot. Right? Okay, so that's about lubricative drops. Second one is warm compresses. So this is something not a lot of people know, but in my journey, this has been a lifesaver. It has helped me get through few difficult years, and I still use them every day. I use this today morning also before this session. So the meibomian glands, they actually get blocked. So they stop secreting tears, the oil layers. So when you must have seen heating pads, right? Whenever we have muscle strain or anything in back and shoulders and legs, we use heating pads. So these warm compressors are like heating pads. You heat them up, keep on your eyes when your eyes are closed. They massage your eyelids, and the glands, the meibomian glands, basically they get blocked. These glands, they liquefy them, and your oil will start coming out. So there are days when as many eye drops I put, it does not help. I keep putting more and more eye drops every 10-15 minutes, but I do one round of firm compression and it works like magic. I'm good for next 2-3 hours. Right? So I'll show an example of this thing before we get into details. Not this. Yeah. So there are multiple kinds of eye compresses. This is one I used a few years back. So you microwave it and put it on your eyes. It basically liquefies the glands in your eyelids. Right? Okay. So that being said, the temperature and time for this thing is very crucial. Otherwise, it does not take enough effect. The ideal and recommended temperature is 45 degrees Celsius, and time is around 15 minutes daily, once or twice. Right? If you have never done it, I would recommend you to start with 30 degrees and maybe once a day. See how it helps you, and if it helps you, you can mention it in your regular eye checkups that you have started doing this thing, right? But please don't go beyond this at all, even if you are very comfortable, because it is heat. It can damage your eyes, right? And like this is very much wetted. So the link again is, so there's this Dr. Donald Kolb in US who is one of the leaders in dry. He has done a lot of research around this. Papers have been published, and that is what they have said, that 45 degrees Celsius is what is needed to to unblock these glands, right? And if anybody of you knows LipiFlow and all, he's the creator of those devices, right? So now that's why it is very important to regularly check the temperature of the warm compress you are using. Like you should not be like, I'm using it at 40 degree and it's actually 60 degree. So it is something you have to take with a lot of care. So I regularly check my eye compress using a handheld thermometer. So this is the thermometer I use. It works very well. I think it has till 60 degrees Celsius. I put it on whatever warm compress I'm using, and I am comfortable that I'm going not going beyond 45. Right? And timing is something you can do yourself easily. Then, like how I started with this. Initially, I started with a wet towel, like putting a napkin in your warm water. It is very good to start with, by the way, but it was very cumbersome because I have to get up, go heat it up again, and then again put on my eyes. It will not retain heat, right? So because heat was not retained, I use a microwave based. So you put it in microwave if you have microwave. This is one I have used for many years. It was also fairly good. I think very easy if you have a microwave. But again, you have to get up and do it. So if you are in a very dire case where like you really need this thing, then I eventually switched to USB based masks. So USB ones are of course a little more expensive than the towel and microwave, and you may have a little bit inhibition because it's electrical. How I cross my inhibition is the power rating is very less and nothing can happen, nothing much can happen. So I started using it based on a very good community feedback. So we have a dry community where people talk about it, and I have had very good feedback about the masks that I started using. So I initially started with something like this. There's an aroma mask. So again, no affiliation to this thing. You can go buy Amazon. I really don't get anything from this. So aroma mask is this one is a pretty good mask. It maintains consistent heat, so you can set it up to 40, and most importantly, it can even go beyond 45 degrees. So there are various conditions of eye where you need beyond 45 degrees. So please be very, very careful the temperature you're using it at. Use the thermometer if you use it, and you can also talk to your doctor about it. Any good eye doctor with respect understanding of dry will know about this thing. So don't go beyond, I think the 40 degrees Celsius is at the second layer here. Don't go to the third one. It is for different cases of ice, right? Use the thermometer, use it very carefully and very regularly, right? Finally, if the microwave one works, even if your wet towel works, if you have never done it, if that helps you with wet towel, also be careful about the temperature. It should, you can keep it on your hands and see if it's not burning your hands, right? That's the basic thing to start with. So if this one also, these two work, help you very much and you really need more help, you can think about this thing. This is what I use these days. So it's from the same company, a little more expensive, but the fitting of this thing, the flexibility, the adjustability is all very good, right? So I also have these masks along with me because, as I said, I keep using them, so I can show this thing. So this is the first aroma mask. Again, no product demos, I use them every day. So this is the first one, and the second one is more convenient. As you can see, it's very better designed, right? Okay. So these are the masks. You can like even choose any other one that your doctors are suggesting. But whatever you choose, please make sure the temperature is good and follow the timing. Don't go beyond, and don't do very under also. Like of course, when you're starting, start with 30 degrees Celsius or even low. But if you want to get the max benefit out of it, and if it is helping you, try to go to this level. Maybe in 1 year, 2 year, whatever. Right. Okay. So that is about the warm compressors. These are for your oil. Now the third one is moisture chamber glasses. So you might have noticed that, like if you got a chance to notice, my eye glasses are not standard eye glasses. So whenever your eyes are dry,
Nishant,
anything that
just
Mhm.
1 minute before you move on.
Yeah, yeah,
Some people have shared in the chat that they all have not benefited from warm compressors but have benefited from cold
cold.
compressors.
Yeah.
So that
Okay.
is also a thing to be
Correct.
noted, that
Yep.
you
Yep.
have to try out different things, and whatever works for you and your dry eyes is what works for you. Like Nisha
Correct.
said right in the beginning, that don't copy somebody else's treatment because your eyes are unique to, and your problems are unique to yourself. So that's what I just wanted to emphasize. And somebody, Sumit, has also suggested Elice's is a good mask. So maybe
Hmm.
you can try these out. Whoever wants to
Yep.
try out have many options which have been shared today. So you have to try and see which one works for you. Just like teardrops, you have to try a few before you figure out which one works best for you. Similarly,
Mhm.
this is also another device which you have to try out and see what works best for you.
Yep. Thanks. So
Can
very good call out. Yeah, madam. Please go ahead.
no, no, you go ahead.
Yeah, all right. Yeah, so that's a really good call out. So I do know a friend of mine who uses cold compressors, and that helps them a lot. So for autoimmune patients, some of them cold compressors do work very well. I don't have an example handy because I haven't used them much, and warm compressors do the thing for me. So you can definitely try. And I haven't tried this eye mask, but eyeless. But whatever mask you try out, please do be careful about the temperature, right? So the handheld thermometer is not very expensive, and given it is heat, I would really suggest you to be careful about the temperature using these at. Right? Okay, cool. So getting back to moisture chamber glasses. So you may have noticed that my glasses are not like normal glasses. So the glass that I use is something called a moisture chamber glass. So whenever your eyes are dry, anything like wind, air, pollen, dust, they affect your tear system. So you need protection for your eyes. So moisture chamber glass is a very special glass which has protection. So you can see there's this silicone padding around the eyes. So it helps the tear evaporation. So I use them. I have been using them for many years now. They help me a lot. Again, it may not help everyone, but this is one of the most standard dry eye treatments, and it helps most of the people, right? So It avoids the tear evaporation. And even if you don't use moisture chamber glasses, you have dry eyes, you have to protect your eyes from wind, air conditioners, fan, and dust. So if you have dry eyes, you may try to notice that whenever you are sitting close to AC ducts, you have most problem. That is because the air erodes your tear film. It evaporates. It helps your tears to evaporate much faster. Same with wind, fan. Fan is a very big culprit for me, and it's for many people. So stay away from AC vents and fan as much as possible if you have dry eye trouble. And you can try to use humidifiers in closed rooms. I used an alien one, which there's a link. There are humidifiers are many. People who have parents, you must have used for your kids, right? So when these general things are not sufficient, you can try custom glasses. So now moisture chamber glasses, one unfortunate thing is it's not so common in India. So it's not available in India, unfortunately. But what is available in India is onion goggles. So when you cut onions, you get tears in your eyes. So onion goggles are something like this. They also have a silicone protective padding. I don't think it's silicone, and I have not tried it personally, but it works for many people based on my research because it has a protective padding. So it helps your tears to not evaporate, right? So this is the protective padding. So you can try out with something like this for a few days or weeks and see if that helps you. If that helps you enough, maybe you can consider something like this, depending on your own situation. But as I said, it's not available in India, unfortunately. You'll have to import it. The one I'm using is a Sienna model. They have various frames, so you can talk to the company and they can help you about the right size for you, right? So when I got these Sienna glasses initially, my tears were getting evaporated very quickly because it had protected protection, and they came like that. They came like a lot of drops on ice. And I used to work in an office setting back then, so it did not look so great. So I figured out there's something called optifog coating from Essilor, which prevents the evaporation very quickly, right? Well, it is good that it prevents, but it does not look so great in a like public setting. So something like that helped me maintain the look of these glasses. These are again very extreme if you work in a very public setting, but I think it's a good thing to call out because I had some trouble figuring out how to like manage my appearances in office with these, right? Okay, and Sienna, I think I forgot to mention the price. I think it is around, if you import and all, it will go around 25-30K. So it's quite expensive. So I think again, depending on your own personal situation and if things help you, you can think about that. Right. Okay. Finally, the most obvious ones, you have to start managing yourself. Right. Apart from the best practices like blink every 20 seconds, look at objects 20 feet away, keep screen down. What helps people with dry a lot is blink reminders. So I use a lot of blink reminder apps. I'll start one for a few seconds for everybody to see. So you can see whenever I work, it blinks. It gives me a reminder that you have to blink. And I just somehow blink. When you work on screens, your blink rate reduces, and less blink rate also causes dry. It increases your dry, whatever cause you have, right? So I use a lot of blink reminders. We will talk about them. Right? And to start with, if you cannot look at screens, stay away for as much as time you need. Stop watching movies, stop watching content, stop watching TV series, whatever. I'll turn it off in a few seconds. Just wanted to emphasize. Right? So even when I'm talking, when you're in meetings, you'll not realize. But this comes up on your screen, so you have to blink because you know it's troubling you, right? And like if things are not working for you, you use a screen, try to change your job if it works for you. And if for entertainment, you can use audiobooks or podcasts. Audible and Spotify are some things I use a lot. If that is not possible, move beyond audio video for entertainment. Go into sports, exercising. And added benefit of exercising is it's an immunomodulant. It will help your autoimmune as well if you have that. Right. Okay. Here are if you are working on screens, you have to maintain a strict blink pattern. So I use a lot of apps on Android when I'm watching movies when I can on the days I can. I have a sound based reminder on my mobile. So it tells me in every 30 seconds that I have to blink. It blinks, it gives a beep. It's not so great for people around me who are watching the movie, but when I'm watching individually, I do that. There's an app which I use on my phone. I couldn't keep the link here. I'll update it later. And the one that I'm using here is the final one on Mac. There's another good one on Windows and Mac. You can follow these links. I think the first one, I think all of them are free. The last one is a like trial kind of version, but you can still use it. Right. Okay. I'll stop this one for now. Since you guys are not used to it, I am very much used to it. Finally, if you have the most trouble when you wake up, like during the day you're fine, but if when you wake up you have the most trouble or you have trouble sleeping, you can try eye ointments before sleeping. And there are also eye masks. Some people, like people who have eyelid issues where eyelids stay open, so your tears will evaporate. When eyes are supposed to be closed and relaxing, your tears will evaporate because your eyelids are not closed. So you can use masks. I initially had tried with something like this, and that's again did not work well for me, so I have stopped using it now. But this was a good one. It's just maybe if that's your trouble, you can try it out, or you can try something else. It's just an example how of things you can try. Cool. Finally, if you need a boost in your dry journey, and there are some very expensive therapies which may or may not work. They are light and massage based therapies. One is IPL. If you do IPL, try to get this machine. It's the best one. Lipiflow is massaging plus heat. Then meibomian gland expression is they'll probe your meibomian glands using earbuds. So they are the like most economic out of these three. I have tried, like none of these worked for me very well. Now none of these work, but maybe some of these helped me throughout my journey. So depending on your individual case, if your doctor may recommends, you can try if it works for you. Finally, I'm not a doctor, but I think it's worth to mention a few things. Right.
Yeah.
First, like we have medicines for autoimmune diseases, right, which curb the systemic inflammation in our body. There are topical immunomodulants, which are very effective for some people. So if you have autoimmune diseases, your doctor will suggest cyclosporin at some point of time. That is Restasis or Sequa. Sequa is a bit better version of Restasis. It has much better delivery. But these should be used at least for like 6 to 9 months, I would say, even a year, if your doctor suggests that, because it's like your autoimmune medicines. They take a lot of time to work. And finally, like other medicines, these are not your standard eye drops. So just don't go shop for a cyclosporin or that drop, right? It can cause unexpected side effects. So, but yeah, this is a good thing to know that if you have a very big trouble, very much trouble, your doctor will explore it at some point of time, and you should use it for good amount of time and not experiment with this. More importantly, right? Finally, many of you would be on HCQS or Plaquenil. So HCQS is one of the safest drugs and very well understood. However, like because it is very complicated for a very few people, it can cause some irreversible corneal damage. Not every medicine works for everyone, right? So for very few people, this may cause issues. It has some side effects for few people, but for people whom it works, it gives a lot of benefits. So if your doctor has recommended this thing, please do take it. It will help you a lot. And your doctor will also guide you that you should do eye checkups every 6 months or every year or every 3 months. That is because for very few people, it can have some side effects. So please follow your doctor's guidance seriously and get your eyes checked whenever they tell you. Right? Because the only treatment in that case is to switch the medicines. Yeah, so that's a note on HCQS. Finally, there are some vitamins which are known to affect dry eyes, especially these ones. I think we all should check all our vitamins every 6 months. And omega-3 fatty acids is like talk of that it's not very clear cut thing, but people say it helps. Some doctors also say it helps. Many doctors even recommend it. So if you don't want supplements, you can incorporate walnuts, flax seeds, and chia seeds in your diet. No side effects, and it will give you that. If you don't consume fish, if you consume fish, you get it anyways. And finally, while it seems like a never ending journey, there are a lot of people who have come out of dry eyes. You can go to this place and you'll realize there are people in very bad phases and they have still improved. So, this is from an NGO, a non-profit organization in US, especially for dry eye. And these guys are literally awesome. They have helped me a lot in my dry eye journey. And it might seem weird, but a lot more than even doctors. They don't give you medicinal advice, but they have worked with a lot of patients and they know what works, what does not work. Right. So you can talk to them, you can, they have mental health meetings and all. They have meetings around scleral lenses, they have meetings around neuralgia. You can talk to those patients. Right. Also, you can talk to them in anonymous mode. Like, so they have a recent community. It's like a forum. You don't have to disclose your details and you can just talk in anonymous mode. Right. Okay. That's all I had. Any questions? We have a little while for questions.
Hi, Nitin. This is Sumit from Bombay. I
Hi, Sam.
have MGD. So you mentioned about MGX. Okay.
Hmm.
So can you
Yeah.
elaborate a little bit more? Because I only time I got it done was along with IPL, and my glands are still blocked. So do people carry out only standalone MGX, and is that effective? Or should I go for probing because the glands are still blocked after 2 sessions of MGX? Thanks.
Okay. So since you say your glands are blocked, I personally haven't gone through any uh, device in India which can tell the glands are blocked. That I am not a doctor again, but I have explored this path a little earlier. I was not able to find an effective diagnostic which could tell me that my glands are blocked, at least in India.
No,
So
there are
that's
no devices. They manually try to express it, the
hmm,
eyelids, right? And if
yeah,
then nothing comes out, the mebum doesn't come out, they label it as blocked.
yeah. Then there can be other, according to like in my humble understanding, there can be a lot of other reasons. Your glands are blocked. You don't even have mebum, right? If you have nutritional deficiencies, you don't even have mebum. That's my understanding again, for as a patient. So that's about MGX. Now MGX, whether it works or not, like for me, whenever I have got MGX done, um, it did work. It helped me feel better for the first day, but after that, the effects went away.
Excuse me, can we have the expansion of MGX and a little more clarity on what it is? Is it a
Yeah.
treatment? Is it what is it?
So
And
MGX is
can
meibomian.
we stop sharing? I have you stopped share, Dishant?
I haven't, but I'll re-enable it.
If you don't need to share, then just stop share so that we can talk to each other.
Yeah, yeah. As in, it just stopped for whatever reason. Don't know. Yeah. Anyways, the screen should be
Why,
good now.
why am I still getting share?
Anyways, the content is done. So I can anyways stop. The content is done. Right. Okay, yeah. So, talk continuing on MGX. MGX is meibomian gland expression. So, as I mentioned in eyelids, you have meibomian glands which secrete tears. So sometimes they get blocked, for which there are various ways of expression. One easy way is doctors put eyebuds kind of devices onto your eyelids at the end of your eyelids. They know where they are, and using slit lamp they can put it. So when they press it a little bit in a very controlled manner, a little bit pressure, the mebum starts coming out. Now there's a very standard, like you must, some people who have explored it a lot, they may have seen a lot of videos on YouTube where doctors say that when your eye meibomian glands are very bad, you press on them, the after a lot of pressure, the mebum that comes out is toothpaste like very hard. That means that's a very bad tear, that's a very bad mebum. Ideal healthy mebum should be you press on your eyelids and it should come out like olive oil, transparent kind of thing. So now in cases when it does not work, there are two ways. One is meibomian gland expression, one is probing. So meibomian gland expression is, doctors put earbuds kind of thing, and tears start coming out. For normal cases, that works very very well. Now for me, I have done around 3 4 sessions of it after IPL, and it helped for the first day. Did not go beyond the first day, the comfort, for whatever reason, right? And then the question that one person just had was about meibomian gland probing. So again, in my own research and evaluation, I haven't found any reliable places in India which do meibomian gland probing. So meibomian gland probing is because they are cylinder-like structures. A very advanced way, which is very common in US and all, is they put some syringes kind of thing in your eyelids into the glands to clear your glands. So it's like a tube. The tube has got blocked with dirt, debris, whatever. So you put a pipe to clean it up. So they use syringes kind of thing to clean up your meibomian glands. So if that is the actual problem, it will help people in US. But unfortunate for us in India, it's not that common of a reality. I know one or two places where they do it, but I haven't personally gone for them is because I don't believe in experimenting like crazy. I feel that if just one center is doing it, it's not very reliable. That's my take on MGX.
Thank you, Nathan. And these centers are where in India, if you can mention?
Let's avoid
Okay.
that, but
Okay.
on Google you should be able to find them out if you really need to.
Okay. Thank you.
Yeah. Okay.
Nishant, there
That
are a few questions in
yes,
chat
we'll go to
box.
that.
Yeah,
Okay, let's check those now. Yeah,
I
and before we stop, as I had said, there's the blog link that I had placed in the starting. So if you have any queries, you can put comments there. Again, non-medical things around the content. I can, when I find time, I'll check and respond. Right now, getting to the queries, let's just see. Um, so punctal cautery. One second. So punctal plug and punctal cautery, I would defer to the session that was taken by I cannot remember the name of the doctor. The
code
code clinic
care
session.
session,
Yes,
the code eye care program that I mean, the collaborative program
correct.
we
Yes.
did talk about that. Though, of course,
You please check that.
focus
That
was
has very
not
good details.
no, the focus was not on punctal cautery as a procedure or anything. She was basically dealing with the basics of dry eye management. But
Correct.
they are a good center, and so is I think LV Prasad
Correct.
Eye Institute in Hyderabad. So,
Yep.
like some of you have asked where are the centers in other cities like Mumbai and all. Frankly, we also don't have answers because unless they announce themselves specifically as dry eye clinics, which Shankar Netralaya and LV Prasad Eye Institute do have dedicated dry eye clinics. I don't know which other hospitals really have such dedicated clinics, but I think Hinduja Hospital had a fairly comprehensive dry eye checkup. So maybe you could check there. And like somebody has already suggested, they've given names of two doctors in Bombay. So maybe you can check it out. Basically, local level, you'll have to do the uh, checking on your own because there are no, the standard ones that we know of are the Shankar Netralaya in Chennai, the LV Prasad Eye Institute in Hyderabad, and they have branches at other places where they can recommend other doctors who can help under you at your place. So you'll have to write to them and figure out if there's any particular person in city. In Ahmedabad, I know of a clinic which does dry eye testing, but I don't think that clinic does punctal cauteries or any such very specialized kind of treatment. So even if I were to do it, I think I would rather go to Chennai and go to Kodai Care or to Shankar Netralaya and check these specialized treatments out because the you have to be very confident about the doctor being very good at what they are claiming. So I think some research on your part will be required. And then, of course, the ability to be able to travel, to be able to take time off, to get those things. So it's something that each individual person will have to consider. I think besides this, there was one question earlier by Smita, or who was that? She wanted to know if you could answer the question of do you have
Cyclosporin.
upper limit, for how many years can you use cycle?
Yeah. So I haven't it has been many years since I have used cyclosporin. So I don't remember exactly, but the doctor who's prescribing you should be able to check with them. And it's a very standard drop. So any
Right.
proper dry eye doctor, you talk to them, they'll be able to tell how much you should use cyclosporin for.
If we want personal experiences, then maybe I
Hmm.
tried it out for a few years, maybe 3 or 4 years, and then I didn't need it anymore. So it does work, but then you have to, like Nishant said, you can't stop in a month and say it doesn't work for me. You have to take it for a longer period of time, at least 2, 3 years. Then you may get the advantage of that medicine. So
Correct.
nothing works like magic.
Unfortunately.
Hey, I wanted to add a point here when we're talking of cyclosporin. The
Mhm.
lifitegrast or Xiidra is available now in India under the name of Sika drops. And initially it was launched at 12,500, but now they've made it to 2,800 rupees for a month's supply. So that's considered even slightly better than cyclosporin.
Well, that's
Yeah,
nice. Nice to know. Can you put this on the group also when you, I mean, we won't be able to go back to this chat. So all these important suggestions may also be put on the group.
I'll
eh,
do that.
so
I'll
that
do
we
that.
can benefit from them. And I think there was yet another question which we missed. Nishan, can you just check?
Yeah, I'll just check. So punctal plugs, I think, is answered. Doctor had explained that very well. MGX we talked.
Yeah. Punctal plugs, did you explain?
Yeah, so punctal plugs we defer to the
Because
code session,
maybe
but I
some people
think
don't know what punctal
sure,
plugs.
sure.
You can
Yeah, I think
just
we are anyways
elaborate a
done
bit
with
on that.
questions, so
Yeah.
we can get to that. So basically, punctal plugs is so there are the tears in your eyes. They drain into some glands in ducts in your. So basically, the tears go from here to some ducts in your nose. So for people for whom the tears are very very less, as in the tears, you have to retain those tears in your eyes. You should not like they should not go back into your nasal ducts and all. So for that, the ducts in your in the corner of eyes get plugged with some devices, triangular kind of devices, so that will retain whatever tears you have. And not just tears, if you put eye drops also, they also go into your nasal ducts. So if you put those plugs, the eye drops and your natural tears, they'll stay in your eyes a lot more. They'll not get drained into the nasal ducts. For that, punctal plugs are used. It's generally used for cases of very extreme aqueous deficiency, where if you don't retain the tears, your eye starts getting eroded. So in those cases, the eye cornea gets very red and very rough because there's no lubrication. So in those cases, doctor like have to do punctal plugs. That is, they have to retain the tears in your eyes or the drops in your eyes. Even he put drops and eyes are very rough, they'll just drain away like that.
I'd also like to add here that you may have heard other terms
So
being
to
used.
just
Sometimes doctors talk about punctal occlusion. Now it's the same thing. Punctal occlusion
keep
is
them, they use
kind of.
punctal plugs. Now, uh,
Hello, can you hear me?
I can hear you now. It was a little breaking for me,
Okay,
but
okay.
it's okay now.
So what I was trying to say is just to sometimes you will get confused by these terms: punctal occlusion, punctal plugs, punctal cautery. They're essentially different forms of kind of blocking the hole which allows the secretion to pass into the nose. So what Nishant was explaining is punctal occlusion by punctal plug, which is a kind of small device which is inserted into that hole, and then that retains the moisture in the eye, or even the eye drops that you put are retained better for some time. That is the assumption. The problem that some patients face with punctal plug is uh, they seem to fall off. I have not used any myself, so this is not personal experience, but this is experience shared by a lot of patients, that those punctal plugs are so small, even if you kind of rub your eyes, or sometimes you don't even realize, so they fall off. So then you have to get it done all over again. So these are temporary punctal plugs. Then there is something called a permanent punctal plug, and there that is supposed to help you better. And now what we were told by the code eye care doctors was they perform a small operation where they cauterize that section, and that is a more permanent solution to this occlusion that is required. So but in any case, it is not for you to choose what kind of treatment you need. You should allow the doctor to examine you and then suggest what treatment is required for your dry eyes. So it is important to say, you can't buy a dry eye treatment by saying, I can afford to do punctal cautery, so let me do it. So ideally, the doctor would check you out and see whether you are a candidate for that particular process, or whether you actually need it or not. You may be able to manage with lesser invasive techniques. So if that is possible, then people would prefer that you get better with uh, lesser invasive techniques, maybe changing the lubricating drops or doing something else, which helps. So you have to allow the doctors to evaluate and then discuss the options with them. So even if you are ready to do punctal cautery, it may not be advised for you. So I think that is a very important point. But unfortunately, I think this whole thing about dry eye clinic is something that we need to explore, because not every ophthalmologist is as well trained in dealing with dry eyes as we wish they were. So maybe it is important for us to actually go to the dry eye clinic and get ourselves evaluated properly. Yeah. Anything else? Any more questions?
Yes. So is this for only aqueous tear deficient eyes or for MGD also, the punctual plug?
Uh, Again, like I said, the evaluation will be done by the expert and they will advise what is best for you. It could
Okay.
be for both. It's not only for aqueous, as far as I understand, because the secretions in the eye should remain within the eye. So the whole point is that they're getting wasted by going through the nasal passage. So the best would be to leave it to the doctor to kind of decide what works best for you and then trying it out.
Okay, thanks. I have a question for Nishant.
Yeah.
Nishant, I've read a lot about diet for dry eyes. Rather, I've heard a lot. Is there a particular diet that you've experienced which has helped you other than the omegas, in terms of the non-inflammatory diet or diet which can keep the burning or inflammation under check?
That's $1 million question, and unfortunately, nobody in this world has an exact answer to it. So, what I have found is like I have become gluten intolerant. However, whatever reason happens to some people with autoimmune, but I haven't found that eating something fixes my dry eye. So, what I do is I maintain a food diary. If something next day or next 2 days I face a lot of problem, I try to eradicate that for next 2 3 months and see if the effect is consistent and I use it. That's all I can say on that. Like, there's no clear cut answer to this thing, but generally, if you eat a healthy diet, like you don't eat a lot of inflammatory food. There are inflammatory food, you can try to avoid that and see if it works for you. Again, it's all very radical. For it works well for some people, it does not work. I would suggest, if you want to go down that path, keep a food diary, but don't go crazy, because what works for some people, it may not work for you. But if you feel it works, keep a food diary and see if it helps. But generally, best practices like not eating very late, keeping your digestion very good, and they help eyes and all other systems of the body for sure.
Reducing stress is one of the most important things in reducing dry eye, I think. If you are tired, even if you enjoy yourself too much, too much of entertainment can also cause you stress and cause dryness to increase. So you have to measure your activities, you have to manage your levels of fatigue, and of course, food, balanced diet is always recommended. So I think it's a combination of several things. There is no one plus one is equal to two kind of equation here. It's a multifactorial issue, which Nishant said right in the beginning, and we have to learn to manage it. And again, we have to remember that not all days are bad. Some days are very bad, and those days we have to just accept and sleep and not try and use the computers and not do whatever work we had planned for that day. And some days are fine. You can go see movies, you can enjoy yourself, you can work on the computer for a few hours or more. So, you really have to take it as it comes. You will learn to recognize the signs that your body is giving you. And I think that is very, very important. You have to learn to listen to your body, and you have to learn to um abide by what the body demands. If it says you need to rest, you need to rest. So there are so many dinner plans which I cancel at the last minute, and so many things like that, because, well, that's the way our disease is. It is not a planned kind of problem. So you need to be able to take it in your stride and not get terribly depressed by it. And hopefully, when you have an exacerbation of your dryness, then use all the techniques that Nishant has said. Try and do hot compresses, or pull out your whatever microwave heating pads and whatever, and try and get yourself under control. So use more eye drops. And maybe it was too simple to explain, so Nishant didn't mention it. But you can use your eye drops far many more times than the doctor has prescribed. He may say 4 times a day or whatever, but if you need them more often, please use them. And always use eye drops before your eyes dry out. Don't wait till they start aching and feeling extremely painful and then put your eye drops. So you use it more frequently. When you don't need it, you won't even remember to put it. So if you feel that you need it, please put your eye drops. And therefore, one of the things that Nishant didn't mention, but which is very, very important, is you have to use preservative-free eye drops. So that is very, very important. So preservative-free eye drops are necessary, because if you use cheaper eye drops which are not preservative-free, then they may cause damage to the cornea because of frequent use. So unfortunately, we are doomed to have an expense of managing our dry eyes. And it is important that we use good grade, good quality, maintain hygiene when we are using eye drops. You should always wash your hands, use only your own eye drop bottle. Don't share your eye drops with the other people in the family. Each one has to have their own bottle. If more than one person is using eye drops, you should each have your own bottle, marked bottles. So do these small, small things, and that will help you in the long run. Now, do we have any more pressing
Just to
questions?
add to what Kirtida ma'am said, so very well said that you have to use it before your eyes feel dry. And if you stop yourself from using those drops, like my eyes will recover and all, that's not a good path to go. Your eyes will get eroded. So you should not underuse your eye drops. Whenever you feel like your eyes are getting dry, please put in an eye drop. And even if you feel the need in public, please try to get comfortable to use them.
Yeah. And most importantly, don't feel guilty about not being able to do work on certain days, because, well, certain days it's difficult. Like, I recently underwent a double cataract surgery, and I've not used the computer. I've not worked for long hours on the mobile for a very long time. I'm slowly getting back now. So when your eyes need rest, you need to give it the rest that it needs. And it could it and as all dry eye patients should be aware, that any procedure that is normal for other people still causes additional dryness. When I went through these cataract surgeries, not everybody suffers from such severe dryness, but I suffered from additional dryness because of the existing condition. So you should be aware of that, and you should take it in your stride. So I didn't plan any sessions, any work during those 2 months, so that I could properly take rest. So you have to plan your work. Yes, maybe sometimes take a break, sometimes reduce the number of hours, change the nature of your job. Unfortunately, we still don't have uh, proper solutions to these things. So till then, we have to make adaptive lifestyle changes, and we have to try and manage as best possible.